While some Canadian parents await the return for back to school, Omicron cases continue to surge and COVID-19 tests may not be accessible. So, what can families do should somebody in your family get sick and may need to hunker down with the resources they have at home? We want to bring in Dr. Dina Kulik, pediatrician and founder of Kid Crew. Hi, Dr. Kulik.
Good morning.
So we want to get some news you can use here, some tips actually for parents who may find their kids being sent home. First, let's talk about the common symptoms of COVID-19 and how they may vary in age.
It really is the whole gamut of viral flu-like symptoms for kids and adults. It doesn't really matter what age you are. Many people have runny nose, some people have coughing, fever is quite common, as well as stomach flu type symptoms. So vomiting, diarrhea, belly pain, and many people also have sore throat.
So literally no way to distinguish COVID, be it Omicron or Delta necessarily, from the typical flu.
That's absolutely true. It really is any viral symptom you could think of.
Right. So that's why testing is important. But be that as it may, since we don't necessarily have access to as many tests as we would like, if someone is sent home from school, what would be the best steps to take, or even if you just wake up feeling this way?
Most kids are really doing quite well throughout the pandemic, and even with this variant. They might feel achy, they might have these symptoms we just spoke about, but by and large, the way I counsel families is the same as we would do for any other virus. So rest is great, lots of fluids. If your child has less appetite, that is perfectly okay as long as they're drinking, even if that just means small amounts but more frequently, making sure they're getting all the rest and sleep that they can get. If they have fever or aches and pains, you can use medication like acetaminophen or ibuprofen, and it's best to review with your own healthcare provider what is the best dose for your child, because it's based on weight of the child, how much medicine to give and how frequently. And for people that are a year of age or older, honey can also be really helpful and can decrease the length of time that you're sick for, can make your throat feel better, but we never want to give honey to babies less than a year of age due to the risk of botulism.
Right, and we're also showing some non-medical remedies, especially for the little ones who you don't necessarily sometimes want to give medication, or you're not even supposed to. So I find the saline sprays are great, as well as humidifiers. We've got those on our list.
Absolutely. So a lot of little kids are bothered by congestion and coughing and postnasal drip. So to mechanically remove some of that mucus with a saline spray or saline drops and a suction, and using a humidifier, which puts humidity into the air, so when you breathe it in, it can loosen kind of all the mucus and help relieve some of those symptoms of congestion.
Yeah, you just want to clear those airways, right? It's so hard listening to them when they're all stuffed up. Do these symptoms, doctor, vary based on vaccination status? Have you come across that, and are the studies showing that?
I haven't really noticed that in practice, and I've had very many patients and family members that have COVID in the past couple of weeks. Some people seem to have very mild symptoms even though they're not vaccinated, and other people that sometimes end up in hospital even though they are double or triple vaxxed. It's not super predictable, but in general, on average, people do better and have less severe symptomatology if they are vaccinated.
Okay. Last question. I got about 30 seconds left. When should you go to the hospital?
If your child isn't able to tolerate any fluids, they can't keep anything down, whether that's because of vomiting or fever or lethargy, if they're not rousable, you can't have them interact with you, they're not talking to you, they have a real difficulty breathing, they can't talk, they can't eat, they're unable to catch their breath, or they're turning blue, absolutely go to the emerge. We want to make sure that child's okay and give them support.
Yeah, don't wait for an ambulance, just get in the car if you can.
No, if your child's really unwell, you should definitely call 911 because they can access, life-saving therapy and therapy right then and there. Getting in an accident, driving your child to the emerge is not something that I recommend.
Oh, great advice, Dr. Dina Kulik, pediatrician and founder of Kid Crew. Appreciate it.
You're welcome.